Hey guys, welcome to the live stream. I am going to share this out on my Facebook page, but I wanted to make sure you guys can all see what I'm doing. Wanted to make sure you guys knew, had the answer to the question, what are you doing to update your plan of care? I don't know why it's not. There we go. Update your plan of care due to cancellations and no-shows associated with the coronavirus. So if you guys are catching this live, I appreciate it. I'm not even going to waste my time with that. Let's get in here. So CMS Chapter 15, you can find your answer in here. I'm going to zoom in so you guys can see it a little better. The situation is patients aren't coming, whether you're canceling them, they're canceling them, the state government shut down services. How do you document? So if we come into section 220.1.2, this takes us down to Part A is establishing a plan. Part B is the contents of the plan. But what we're looking for is Part C, changes to the plan. And so some basic information, right? So changes are made in writing in the patient's record, signed by one of the following responsible parties. So the physician, the therapist, the speech language pathologist, the OT. There's information about here, like obviously the therapist can't change the physician's plan of care if it was established by the physician. But ultimately what we're looking for is this distinction right here. So while the physician may change the plan of care established by the therapist may not significantly, that's an important word, alter the treatment plan certified by the physician without their documented writing or verbal approval. And changes of long-term goals, that would be a significant change. However, an insignificant alteration in the plan would be changes to the frequency and duration during the patient's illness. This is what we're dealing with when we talk about COVID-19 and shutting down and what do we do, or a modification to short-term goals to adjust improvement made toward the same long-term goals. So if you're not changing long-term goals, you're not changing major things related to the plan, you're fine. If a patient has achieved and or has had no response to treatment, therapists may delete specific interventions. Now, one of the things we need to address is we're adding, if you're doing e-visit or you're doing telehealth, we're adding to the existing plan of care. So I'm going to talk about that in a sec. This shall be reported to physician responsible for the patient's treatment prior to the next certification. Procedures, modalities are not goals, but are the means by which long and short-term goals are obtained. Changes to procedures and modalities. This is what we're talking about when we're adding in e-visits or telehealth. Do not require physician signature when they represent adjustments to the plan that result from normal progression in the patient's disease or condition or lack of expected response to planned intervention when the goal remains unchanged. Only when the patient's condition changes significantly, making revision of the long-term goal. So everything is going back to long-term goal. Is a physician's signature necessary? And then it says long-term goal changes may be accompanied by changes to procedures and modalities. So essentially, there is information in here as well talking about like illnesses, and what we're looking at here is we've got a couple practical situations. Option number one is we go ahead, we do let's call it a progress note, because remember, we still have like the 10 session requirement for progress notes. It's not a 30-day requirement. We go ahead, we do a progress note basically stating this patient is no longer being seen in person in the clinic due to the COVID-19 restrictions. We're offering e-visits or telehealth to this Medicare beneficiary to continue to progress toward established long-term goals. That's an option. You send it out to the physician office. Potentially the physician's not going to be able to sign it because they're not there. But that's where you would come up here looking at certification periods and find the information on delayed certifications. I'm not going to get into that right now, but all of that information is up here. Sorry, I hate scrolling while you guys are watching. I always feel like it gives you a headache. But anyway, so you would look at delayed certifications because the physician's not around to sign it. You would look at potentially, if you're not doing e-visits, you're not doing telehealth, you're just going to wait for all of this to blow over. When the patient returns, because the last treatment you did was within the certification period. When the patient does return, if the patient returns, you would do essentially a progress note at that point. You'd establish a new certification period at that point. Unless there was a significant change in the condition, you would not bill a re-evaluation. It would be a normal progress report that would establish a new certification period for that time. You would indicate why. If you had an original plan of care twice a week for 6 weeks and then all of a sudden at the third week it was interrupted, you would just indicate, we stopped care at the third week because of COVID-19 precautions, and we're resuming care today, with the same established long-term goals. These are the new findings. This is where the patient is. These are remaining deficits. These, if you're adding goals, these are the new goals. And that would be the document at that point you send to the physician for signature. This is once all of this blows over and kind of things return to normal. So this is the document. This is the source document, CMS Chapter 15. If you guys don't have policies already created in place for how you're handling this, this is the document you reference when you're creating your policy. So keep that in mind. I'll post this link in the video description on YouTube. If you have any other questions, let me know. But once again, CMS is a relatively transparent payer. Like, most situations are gonna be identified, and you'll have resources like this to handle those situations. Go to the resources first. If you can't find your answer, then go to the experts, Nancy and Rick and all the other experts that are out there. And then if you still can't find your answer, collectively, we'll do the research together. Guys, it's Saturday. I hope you get outside. I hope you enjoy some nature, some clean air. Let your brain decompress. And I'll catch you when you ask me the next question. Thanks, guys.